Hi, today we will see about ECG wave, electrocardiography, ECG wave. In ECG wave, normally we all know these are the normal waves. P wave, Q, R, S complex. This is P wave, and because this including Q, R, S, so it is in the complex Q, R, S complex. And here T, this is T wave. So especially if we seeing in the normal finding of ECG, there are P wave from here, this is to till here, so this is P wave, and from here to this QRS complex, and this is the T wave. After T wave there is no any wave. We are seeing here, as we can see, after the T wave there is no any wave in the normal ECG finding. If you are seeing after the T wave also, is there any wave here, that is maybe U wave, present of U wave, so that is not normal finding. It may indicate any abnormal finding. If you are seeing after the T wave also is there some wave here, so it may indicate there is any pathological condition or abnormal finding. So the normal wave is P, QRS complex, and the T wave. Here we can see this P wave, its duration is 0.08 second to 0.10 second, P wave duration. And if you are finding some interval, like this is from the onset of the P wave to till the onset of the QRS complex, this is the PR interval. Don't be confused in the PR interval. You have to keep in your mind that starting of the P wave to till starting of the QRS complex. So from here to till here it is PR interval. So its duration is 0.12 second to 0.20 second. This is the QRS complex. Onset is from till here to till here. So this is the QRS complex. And if we see the ST segment, from it, where from it start and where from it end, so if you want to see the ST segment, it will start into the end of the QRS complex till the starting of the T wave. So from here to here it is ST interval, okay, and this is here T wave. So the duration of the P wave is 0.08 to 0.10 second, and the PR duration is 0.12 to 0.20 second. So this is the normal finding of the ECG. But there are some points that we have to keep in our mind regarding the P wave, QRS complex, and the T wave. Why this P wave appear, why this QRS complex is making, and why the T wave is making, means what the activity is happening in our heart, that's the Q wave appear, QRS complex appear, and the T wave appear. We should know about it. So why this P wave and how this P wave appear in ECG? We can see here P wave, it may show atrial depolarization. Atrial depolarization means when the atria become contraction. So when the blood comes into the atria and it will push the blood into the ventricles, the atria have to become contract. So when the atria become contract, so it is atrial depolarization, and when the atrial depolarization is there, it may show P wave in the ECG. Okay, and QRS complex, why it's appear in the ECG in QRS complex? when ventricle depolarization means contraction. So when the ventricles become contraction and both ventricle will become contract, then ventricle depolarization will occur. So this is when the ventricle will contract, this QRS complex will be appear in the ECG paper. Now T wave. T wave just opposite of these two. When the ventricle become relax, ventricle repolarization, R say repolarization, R say relaxation. So don't be confused in the depolarization and repolarization. Repolarization means relaxation of the ventricles and depolarization means contraction. So T wave present when the ventricular repolarization occur, when the ventricle become relaxation. So these are the activities that may indicate P wave, QRS complex and T wave. But somewhere if you are finding some abnormal thing in the ECG paper, you can find out some pathological condition in the ECG. For example, this is the normal thing, but if you are finding beyond these thing, beyond this normal finding, it may indicate some pathological condition. So if you are finding here after the T wave finish, if you are finding some more wave like this, if you are finding here some wave like this is also, that may indicate it is the presence of U wave. So if you are finding some another wave after the T wave like the positive U wave, so that condition may we will consider into hypokalemia. Hypokalemia means deficiency of vitamin, deficiency of potassium. Okay, so what is the normal value of the potassium? It is 3.5 to 5.1. So if the patient potassium level is below the normal level, it may indicate hypokalemia. If patient is suffering from hypokalemia, there may some changes in the ECG wave. So the presence of U wave always indicate the patient is suffering from the hypokalemia and we can treat accordingly. Now peak T wave. If you're finding this T wave, peak T wave means peak level of T wave, then it may indicate hyperkalemia, means excess level of potassium. Okay, so hypokalemia, if patient is suffering, it may indicate positive U wave in the ECG, and if patient is suffering from hyperkalemia, excess of the potassium level, then the T wave will be in the peak. Okay, now T wave inversion. If you are seeing this T wave, now T wave is like this, but sometime it will invert. Okay, it will invert like this. So when the T wave inversion is there, or ST segment elevation, this ST segment, if it is elevated, like its duration is more and it is elevated and T wave is also inverted, then we can like predict it is myocardial infarction. So these T wave inversion and ST segment elevation, it may indicate patient is suffering from myocardial infarction. Next is ST segment depression. This is ST segment. If it is depressed and very duration is very less and ST segment is depression, it may indicate angina pectoris. So there are these two things we have to keep in our mind, because we will get confused in the ST segment elevation and ST segment depression. Is there T wave inversion and ST segment elevation, that is myocardial infarction. But is there any ST segment depression, it is angina pectoris. Now widening of QRS complex. This is the QRS complex, and if it is too wide, like it will take too time to appear the QRS complex and it is too wide, then there may be arrhythmia. The patient may be suffering from arrhythmia. Now One question for you all. What is paper speed of the ECG paper? It is assignment for you. Just tell me what is the paper speed of ECG. Thank you.